Postpartum depression. My name is Jennifer Blanton, and I'm an Indiana State University student in the LPN to BSN program. This is my community health education project. The population at risk is mothers in postpartum period following birth of their child or children, 6 weeks after delivery. Learning objectives. Define postpartum depression. The time frame, the symptoms of postpartum depression, knowing the difference in baby blues and postpartum depression, risk factors, and treatment options available. Let's find out what you already know about postpartum depression. Take a moment to pause this presentation and click the link below for the pretest. Postpartum period is typically defined as the first 6 weeks after a woman gives birth. What is postpartum depression? Many new moms will often experience a postpartum baby blues. This is defined as mood swings, crying spells, anxiety, difficulty sleeping, appetite changes, feeling overwhelmed, irritability, or difficulty concentrating. It typically begins within the first 2 to 3 days post-delivery and may last for up to 2 weeks. Some new moms experience postpartum depression. Many mistake postpartum depression for baby blues initially, but postpartum depression is more severe and longer lasting. It may interfere with your ability to care for yourself, your baby, or completing daily tasks. Rarely, an extreme mood disorder called postpartum psychosis may also develop after childbirth. What are some signs and symptoms of postpartum depression? Depressed mood or severe mood swings, excessive crying, loss of appetite or eating more than normal, sleeping too much or the inability to sleep, a feeling of overwhelming fatigue or loss of energy, intense anger or irritability, a fear that you're not a good mother or difficulty bonding with the child, feelings of worthlessness, shame, guilt or inadequacy or hopelessness, a diminished ability to concentrate, restlessness, severe anxiety or panic attacks, and thoughts of harming yourself or your child. What are some of the causes of postpartum depression? We know that postpartum depression affects women in many different ways, and it can have multiple causes. Each woman who develops postpartum depression has her own set of risk factors that may have made her more susceptible to its development. Potential causes include genetic predisposition, the mother's health history, environmental, physical, or emotional factors. Most commonly believed that postpartum depression can stem from a drastic hormonal change that takes place during and after the childbirth. Decreased estrogen and progesterone levels place the body into a sudden hormonal shift and can trigger emotional repercussions. The feeling of being overwhelmed by motherhood, or sleep deprivation. Sleep deprivation may also play a large role in causing postpartum depression following childbirth, because women do not often get enough sleep due to their new responsibilities caring for the baby. A lack of sleep can greatly impact how a person functions, feels, and handles situations. Without proper and consistent sleep, women may start to exhibit signs of postpartum depression. Causes of postpartum depression can include family history. Women with one or more family members who have suffered from postpartum depression have a greater risk of developing it as well. A history of mood disorders. Those who have struggled with mood disorders like depression or anxiety, or a more significant mental illness like bipolar disorder, are 30 to 35% more likely to face postpartum depression in their lifetime. A history of postpartum depression in previous pregnancies. Those who have experienced postpartum depression in previous childbirth are more likely to experience it again. Genetics. According to Johns Hopkins researchers, there are possibly 2 different genetic alterations that, when present during pregnancy, may predict whether a woman will develop postpartum depression. These genetic alterations are discovered through blood testing. Emotional risk factors. Women who face emotional and mental stress before, during, or immediately after the pregnancy may be at greater risk for developing postpartum depression. Stressors such as a death of a family member or friend, financial issues such as job loss, or relationship issues, and any other type of stressful life situation can take a toll on the mental well-being of anyone. Postpartum depression and what to do. Be aware of your feelings and emotions. Take preventative measures to limit the debilitating effects of this condition. Awareness of the potential causes and risk factors of postpartum depression allows women and their families to better prepare for this potential outcome. Then, they can take preventative measures to limit the debilitating effects of this condition. Be sure to talk to your physician or mental health care professional if you're concerned about postpartum depression risk factors that may affect you. Getting help is the most important factor. Don't be ashamed. Postpartum depression isn't something to be embarrassed about or to be seen as a weakness. Sometimes it's simply a complication from giving birth. If you have postpartum depression, getting prompt treatment can help you manage your symptoms and help you bond with your baby. Treatment and duration can vary. Doctor may do a depression screening and ask questions about your feelings and thoughts. They may order blood testing to determine if there is an underlying cause, such as an underactive thyroid, that may be contributing to your symptoms. Postpartum depression is often treated with psychotherapy such as mental health counseling, medication, or both. Through mental health therapy, you can talk through your feelings, find better ways to cope with your feelings, solve your problems, and get help setting realistic goals for responding to situations in positive ways. Your doctor may recommend medication like an antidepressant. If you're breastfeeding, any medication you take will enter your breast milk, so talk to your doctor about which antidepressant can be used during breastfeeding with little risk of side effects to your baby. In some cases, postpartum depression can continue, becoming chronic depression. It's important to continue treatment even after you begin to feel better. Stopping treatment too early may lead to a relapse. There are many great resources out there for additional information concerning postpartum depression. Educate yourself. A couple of websites that are recommended are postpartumdepression.org or mayoclinic.org. Search under Diseases and Conditions for Postpartum Depression, Diagnostic Treatment, and other information that you will find helpful. Let's find out what you have learned about postpartum depression. This concludes this presentation. The post test is located below in the link.